Here are my top 5 go-to exercises for acute low back pain. Lumbar rotation hold, lumbar rotation motion, knee hug, prone extension, and child's pose. In this video, I'm going to teach you how to do these 5 exercises, break down the most common mistakes people make, and give you the bigger picture, which is actually what matters most when it comes to lower back pain recovery. For those who are managing back pain on their own, I've created a free lower back pain program. This program will walk you through what to do, what not to do, what to expect, and a progressive rehab program that takes you from the exercises in this video all the way through to your first session back in the gym. If you want to skip straight ahead to the exercises, go right ahead, use the scroll bar below, but I highly recommend hanging around for the whole video so you don't miss the advice that could make or break your recovery. G'day guys, I'm Michael. I'm an online physio and fitness coach. I specialise in helping people train safely and effectively around pain and injury. If you're watching this, you've got a crook back and you're keen to get on top of it ASAP. And I don't blame you. Back pain sucks. Not only does it hurt, but it stops you from doing the things that you love, and it can be pretty scary too, not knowing what to do. That's exactly why I made this video, to give you my top 5 go-to exercises for lower back pain to restore movement, reduce pain, and get you back into the game. Quick disclaimer before we dive in. This is general advice and may not be the right advice for your specific situation. So it's best to check in with your physio or your GP first before trying anything out. And here's what you came here for, the exercises. First, I'm gonna demonstrate them with how I assume you are right now. In pain, limited function, low confidence. Then I'm gonna demonstrate the exercise of what it should look like with no pain, full range of motion, full confidence, so you know what you're aiming at, so you know what you're aspiring to get to and what you can build towards. Exercise number 1, lumbar rotation hold. This helps to restore lumbar rotation. So, starting on your back, you're going to place your arms out to the side and you're going to keep your shoulders on the floor the whole time. Bring one leg up, reach over to the outside of your knee, and you're going to slowly rotate. You're going to stop as soon as you notice any pain. You're going to hold that pain-free position for 15 seconds. You should feel a gentle stretch in your lower back. Come back to the center and swap sides. Now, here's what this should look like. No pain, full function, full confidence. Arms out to the side, lift your leg up, reach, pull over, and get a nice stretch in your lower back. You might even get a nice crack at the end of the range here. We call that free chiropractic. Exercise number 2 is also lumbar rotation, but instead of a hold, it's a movement. You're gonna start with your arms out to the side, feet flat. And all you're gonna do is rock your knees from side to side. Slow, controlled, pain-free. Stop right at the point if you notice any pain, and stick within this pain-free range. Gentle rocking side to side. You're gonna do this for 30 seconds. Now here's what that looks like. No pain, full function, full confidence. Arms out to the side, feet flat, and just rocking those knees side to side as far as you feel comfortable. Again, I'm getting a really nice stretch in my lower back there. And again, you might even get a free crack or 2. Exercise number 3 is a knee hug. This is going to help restore lumbar flexion in a safe and supportive position. All you're gonna do is bring your knees up, hug your knees, and slowly pull them towards your chest as far as able. Stop as soon as you notice pain. Back off and hug in this pain-free position for 30 seconds. Here's what that looks like. No pain, full function, full confidence. Legs up, hug your knees, pull into your chest as far as you can. You should just feel a nice stretch in that lower back. You can even do a little bit of rocking too if you find that comfortable. Hold this stretch for around 30 seconds. For exercise number 4, we're gonna flip onto our tummy. This is called prone extension, or in yogi terms, cobra. So you're gonna start on your hands and knees. You're gonna slowly make your way down onto your tummy. Pop your hands under your chest like you're gonna do a push-up. Relax your lower back, relax your hips, relax your upper body. And all you're gonna do is slowly peel your upper body, starting with the shoulders, off the ground into extension. Stop right at the point where you notice pain, back off, and stay within this pain-free range of motion. Just going up and down. Your goal is to extend as far as you can within a pain-free range. You're gonna do this for 30 seconds. Here's what the cobra looks like when you've got no pain, full function, full confidence. You can see that I'm fully extending my arms. I'm getting full extension of my lower back, even to the point where my hips are coming off the floor, and that's okay too. You're gonna do this for 30 seconds. And last but not least, we have the child's pose. This is one of the most popular yoga exercises for a reason. It helps to restore lumbar flexion in a really safe and really relaxed position. And it's so easy to do as well. All you're gonna do is start on your hands and knees, pop your hands up to the top of the mat, and simply try and sit on your heels. You might only get to say here before you notice some pain come in, so back off and just hold this pain-free position for 30 seconds. And here's what it looks like. No pain, full function, full confidence. Hands to the top of the mat, just sitting your bum on your heels, getting a nice stretch also in your upper body and just sinking deep into the stretch. If you can't do any of the exercises in this video due to pain, restricted range of motion, or confidence, just skip them. Come back to them in a day or so when things have settled down. Do these exercises 3 times a day, morning, midday, and night. Start each session with a 5-minute walk or gentle movement to warm up. Go through each of the exercises for about 30 seconds each. You only need to go through once. And for all the gym junkies out there, no, you don't need to rest between sets. Remember to move slowly within a comfortable range and don't push through pain. The goal is smooth, relaxed movement. Let's cover the main mistakes and misunderstandings so you don't start off on the wrong foot. Number 1, the no pain, no gain fallacy. No pain, no gain does not apply to lower back pain. In fact, pushing through pain and forcing movement is only going to increase inflammation, increase tissue damage, and thus further delay your recovery. Just don't poke the bear. Number 2, overprotection. It's normal to be cautious at first when you hurt your back, but staying overcautious for too long will cause its own problems. Avoiding movement teaches your brain that movement is dangerous. This leads to more stiffness, more pain, and a delayed recovery. Your body is incredibly robust and adaptable. It needs movement and blood flow to heal. Trust in your body. Move as normally as you can. If something bites, pull back. If it feels good, go on ahead. And number 3, exercise is not the be-all and end-all. Exercise alone will not fix your back pain as much as I wish that it did. There are 5 other factors that play an equally important role in your recovery. I want you to remember the acronym SNAPS, S-N-A-P-S. Sleep, nutrition, alcohol, physical activity, and stress. Your body heals in a low stress, high recovery state. If you're not sleeping well, eating like crap, punching beers and darts, sitting at your desk all day and stressed out of your mind, no amount of exercise is going to make a dent in your recovery. I wish all it took was doing the exercises in this video and you'd be 100% fixed, but it's just not the case. If you just do the exercises, you're going to miss out on some really important information that can make or break your recovery. So for those who are managing back pain on their own, I've created a free lower back pain program. This program will walk you through what to do, what not to do, what to expect, and a progressive rehab program that takes you from the exercises in this video all the way through to your first session back in the gym. And lastly, if this video has helped you, please let me know. Give it a like, drop me a comment, or share it with someone who needs it.